Hi, everyone. I'm Dr. Elise Rivera, and today I'm presenting on the influence of park visitation on physical activity, well-being, and social connectedness among Australians during COVID-19. So, neighborhood parks are critical public resources that can yield mental, physical, and social health benefits by providing opportunities to connect socially, spend time in nature, and be physically active. Limited evidence has demonstrated positive associations between park visitation and physical activity, well being, and social connectedness among adults, with scant studies suggesting that this may apply to adolescents too. However, it is unclear whether these findings apply to the COVID-19 context. One major global health challenge was the pandemic, which saw governments implement a variety of safety measures such as stay-at-home policies to manage the spread of the virus. This may have led to Australians visiting parks more often to be active, connect with nature, and socialize with others from a safe distance. Limited studies have shown that park visitation increased during the pandemic compared to before. Additionally, few studies conducted during COVID reported that adolescents and adults were more likely to visit parks for active recreation, and greater frequency of visiting parks was associated with higher well-being among both age groups. However, we identified that further research on this topic was warranted, particularly to understand optimal dosage of park use. This study therefore aimed to examine associations of visiting parks, so whether people visit, and if so, frequency and duration of visits, with physical activity, well-being, and social connectedness 3 months post-COVID-19 national lockdown in Australia circa August 2020, among a combined sample of adolescents and adults. So our study employed a cross-sectional design, and we had just over 1,000 participants who completed a self-report study. And you can see our sample included adolescents, adults, and older adults who were recruited via various measures such as snowball techniques, social media, and researcher and stakeholder organization networks. So you can see our measures on the screen here. So there were three outcomes, the first being well-being. So this was on a range of 0 to 100 with a higher score indicating a higher level of well-being. And similarly for social connectedness, this ranged on a 0 of 1 to 100 scale with a higher score indicating a higher level of social connectedness. And our last outcome was physical activity, indicated as days per week of physical activity for at least 30 minutes per day or 60 minutes per day. We had 3 exposures. So our first exposure was park visitation. So this was simply yes or no. Did you visit a park in a usual week in the past month? Then we had visit frequency. So this was 3 categories. So visit less than once, and visit more than once per week. And visit duration was the final exposure assessed via hours per week. And we used multi-level linear regression models and multi-level mixed effects negative binomial regression models as appropriate to assess these associations. So our sample predominantly consisted of adults, females, those living in socioeconomically advantaged neighborhoods. They were not employed and generally not dog owners. So for park visitation, compared to those who did not visit a park visitors were 1.24 times more likely to report a higher number of days of at least half an hour of physical activity per week. And park visitation was associated with a 3.9 point increase or higher well-being score and a 3.8 point lower social connectedness score. For visit frequency, compared to those who visited a park less than once per week, those who visited a park once per week were 9% more likely to have a higher number of days of physical activity for at least half an hour and a 3.9 point higher well-being score. And compared to those who visited less than once per week, those who visited a park more than once per week were 37% and 34% more likely to have a higher number of days of 30 or 60 minutes of physical activity per week and a 4.2 point higher well-being score. And lastly, for visit duration, a 1 hour increase in park visitation was associated with a 9% higher number of days of performing at least 30 or 60 minutes of physical activity per week. So our findings are generally consistent with those from previous pre-pandemic studies and contribute to a better understanding of the role of parks for promoting health under usual circumstances and new normal conditions. Our study added to the literature as it explored the dosage of park use, which is important for informing recommendations for improving planning, maintenance, and the equitable provision of green spaces and parks in a post-COVID-19 world. And while COVID-19 is no longer declared a pandemic, insights regarding the value of parks can inform strategies and planning for future public health crises and have important implications for sustainable urban design. So I'd just like to acknowledge the co-authors and funding source of this research. Thank you all for your time.